Now, in terms of metastatic disease, there's really like two main buckets where things are initially spread, where we find the spot, and then there's spots elsewhere, whether that's in the lung or outside of the lungs. And then also, there's when metastases develop at recurrence. Here, this resembles a primary tumor treated, and then new spots later on. But they're largely treated the same. So, what does oligometastatic mean? Oligo is the Greek stem for few, and poly means many. First, for lung cancer, here are the definitions, but basically, if you can count them on one hand, it's considered oligo or metastatic. But really, the key message here is limited spread versus widely metastatic. But some people only have a few areas where the cancer is spread. But it's kind of controversial. We're moving away, generally speaking, from number of sites to maybe volume of disease or treatable disease burden. So again, just because we can count it on one hand doesn't mean that we might not consider, different types of radiation that may be a little bit more aggressive than traditional radiation, as long as we feel we can treat all of those spots. But again, things vary on a patient by patient basis. So, what do we know about stereotactic radiation for limited cancer? Basically, the safety is about 1 to 2 folks have short or long-term side effects out of 100 people in the short term and the long term. Effectiveness wise, tumor control at 1 year is about 95%. And the key point here is that it's safe and works well to control tumors, but it's highly dependent on location, such as if things are in the abdomen around small bowel or the stomach, it's really complicated to treat. And it really, really depends on the site in terms of safety and also the dose selected and also the volumes that the radiation oncologist draws. It's very tough. Some of this is gut feel in terms of how safe we feel that it is, depending on the site and the patient and other things they have going on in their life. So these are just hopelessly oversimplified numbers, but generally speaking, it's safe and works well to control tumors.